Alright guys, now let us quickly look at what is ICDS Center. ICDS stands for Integrated Child Development Services. It was a blueprint for the scheme. The blueprint for the scheme is prepared by the Department of Social Welfare in 1975. So first it was based on experiments. They thought it may or may not go on or one, good or bad. So they started off with 33 projects in the year 1975 to 76. 4 urban, 19 rural, 10 tribal. So they were sanctioned in October 1975. So this slowly expanded, and the ICDS was expanded in 1982. So in the beginning, Government of India modified a cost sharing pattern for the ICDS. So the ICDS 60% of the financial expenditure was given to the states and union territories by the central government. The rest was managed by the state itself. Now, there are population norms for setting up of the Anganwadi centers. Anganwadi centers are how the ICDS reaches out to the community. So that is Anganwadi center and mini Anganwadi centers. So what is it is different for rural and tribal areas. So for rural or urban areas, one Anganwadi center per 400 to 800 population, or two Anganwadi centers for 800 to 1600 populations, 3 for 1600 to 2400 populations. Then there is something else called mini Anganwadi center. So there should be one mini Anganwadi center for 150 to 400 population. Then coming to tribal areas, there should be one per 300 to 800 population, or one mini Anganwadi center for 150 to 300 population. So there are a couple of services given by the ICDS. What are they? There are around 6. One is supplementary nutrition, 2 immunization, 3 health checkup, 4 medical referral services, 5 nutrition and education for women, and 6 non-formal education of children up to the age of 6 years. Now, what are the objectives of the ICDS scheme? First objective is to improve the nutritional and health status of the children in the age group 0 to 6 years. 2. To lay the foundations for proper psychological and physical and social development of the child. 3. To reduce mortality, morbidity, malnutrition, and school dropout. 4. To achieve effective coordination of policy and implementation among the various departments for promoting child development. 6. To enhance the capability of the mother and nutritional needs of the child through proper nutrition and health education. So who are the So those are the objectives. Who are the beneficiaries of the ICDS? The pregnant women, nursing mothers, other women in 15 to 45 years of age, children less than 3 years, children in age group 3 to 6 years, adolescent girls 11 to 8 years. Now, what are the services? And let us look at a little bit on each service. Supplementary nutrition given to children below the age of 6 years, and nursing and expectant mothers from the low income group. And so as we went to the center before, they used to give Satyamav. So that's one of the things, and we can write that also. So now there are a couple of guidelines. Each child age 6 to 72 months of age is to get 500 calories and 12 to 15 grams of protein. Severely malnourished child, on the other hand, from the age of 6 to 72 months, to get 800 calories and 20 to 25 grams of protein. Then comes pregnant and nursing women to get 600 calories and 18 to 20 grams of protein per day. Then this supplementary nutrition, one more point is you can add supplementary nutrition is to be given for 300 days in a year. So that covers supplementary nutrition. The next one is nutrition and health education. That is self-explanatory, we can just write it off. Immunization, the 9 preventable vaccines, like said in the abstract trick. So what are they? The pentavalent vaccine or the 5 diseases: Haemophilus influenza, hepatitis B, diphtheria, pertussis, tetanus, Japanese encephalitis, and others. Then comes health checkup. So this is like a routine health checkup that we usually do. Postnatal care, antenatal care, and care of children less than 6 years of age. Iron and folic acid tablets should be given, and a record of weight. So that covers health checkup. Then comes non-formal preschool education. It's like so like we went to the Anganwadi center. It is like an kindergarten organized by the government. So children by between the age 3 to 6 years imparted non-formal preschool education in Anganwadi. Then comes schemes for adolescent girls. There are two different schemes for adolescent girls: Kishore Shakti Yojana and nutrition program for adolescent girls. And so that'll cover what we need to write for ICDS center. So what are the headings? We're first going to write introduction, how it expanded. Then we're going to write population norms. Then we're going to write what are the services given by ICDS center. We're going to write what objectives of the ICDS center are. We're going to write who the beneficiaries of the ICDS center are. We're going to give a little briefing on each of the types of services. And lastly, we can write a little bit on schemes for adolescent girls. And a little bit about Poshan Abhiyan can also be written. Poshan Abhiyan was a scheme launched in 18th December 2017 for the period of 3 years. So its main goal was to improve and strengthen nutritional status of children from 0 to 6 years, adolescent girls, pregnant women, and lactating mothers.